If we are saying this little black spot would affect everyone's 2020, no one would disagree with this statement. The global outbreak caused by this little bug is defined by the WHO as the COVID-19 pandemic.
That COVID-19 can be characterized as a pandemic.
At present, the situation of the world's fight against COVID-19 is grave.
Boris Johnson has been admitted to a hospital.
The Olympic flame landed in Japan, dashing the dreams of athletes.
Worst single-day loss ever.
China has won a victory in this stage while the epidemic is still serious with the number of confirmed cases and deaths high. The world needs China's experience includes many strategies such as the rapid construction of temporary hospitals to treat severely ill patients, converting existing buildings to treat patients with more mild illness, and finally, coordinated treatment with traditional Chinese medicine. At present, while many countries in Europe and the US have adopted the first and second strategies, the third strategy has been questioned. Is traditional Chinese medicine really effective in the fight against COVID-19? I'm in Shanghai, and I want to find the answer to this question. As a doctor, I'm trained in the tradition of medicine as known in the West. It's not surprising that international organizations from my same tradition would only evaluate the effectiveness of pharmaceutical therapies.
Right now that we think may have real efficacy, and that's remdesivir, as you've heard about.
Unfortunately, no single agent has been shown to be universally effective. What if we were to look at traditional Chinese medicine? In the fight against COVID-19, we need every effective therapy. With this question in mind, I talked to experts from the front lines in the fight against COVID-19 here in Shanghai. When did the Shanghai program start using traditional Chinese medicine treatment, and why?
从一开始新冠肺炎的防治过程当中，到后来输入性的新冠肺炎的病人的治疗当中，我们一直坚持着中西医结合的治疗，大约有92%以上的病人都接受了中药和西药的同时的治疗。输入性的受新冠肺炎的病人当中，也有超过90%的中医和西医同时来干预。我们有很好的这个使用中医的这么一个传统的一个观念，老百姓也容易接受，而且呢，我们认为呢，中医中药呢也能起到相应的疗效。
Zhang Huiyang and his colleagues were in the front lines for over 2 months, so they treated and also collected experience from their patients with COVID-19.
喂，看到您真容了。
8 out of 9 people in a family from Hubei were diagnosed with COVID-19 in Shanghai, including 2 kids.
我们一家就是8个人感染，就是能够全部出院，这是一个很美好的结果。
5 of the adults and the 2 children had mild symptoms, so they were mainly treated with TCM. At present, Xu Zheng and his family have been cured and discharged. The Xu family just refilled the prescription from Dr. Shui Honghao and took the treatment for another 14 days after recovery. But why?
因为我们一家人啊，非常相信中国的那个传统中医，而且平时我们在湖北武汉的时候。平常小孩感冒发烧啊、生病或者有些不舒服，通过小儿推拿、按摩，包括艾灸这种方式来进行那个小孩的一些预防和治疗，效果非常好。
The person who has the deepest influence on the present-day practice of traditional Chinese medicine is a doctor by the name of Zhang Zhongjing. More than 1,000 years ago, during the Eastern Han Dynasty, he wrote a book, Treatise on Cold Pathognomic and Miscellaneous Diseases, based on a lifetime of experience. Remarkably, the treatise included rules on the management of epidemic infectious diseases. More importantly, it confirmed the core principle of traditional Chinese medicine, how to understand syndrome differentiation and treatment in traditional Chinese medicine. And how does this work in the Jinshan Public Health Centers? 这是这里 ，OK。
藿香。
For what symptom？感冒。
祛湿。杏仁是止咳的，这就是黄芩。
黄芩。
清肺热，治菌又叫大黄，它是通大便的，要根据每个病人的不同情况，临床上选择的剂量 有时候多一点，有时候少一点。
主症就是
也是清肺热的，有很多做实验了，它能够抗菌抗病毒。
So one patient, one treatment.
Yes,
Maybe one patient will have all of these, but not that.
yes，这些药物它的主要的作用呢，还是清热解毒、杀虫。无论是我们叫轻症的时候，或者是这个普通型、重症、危重症这4个阶段，中医中药都从头到尾都是参与了。一个呢是减轻临床症状，第二个呢让它不要从轻症减少它的转变，轻症转成重症。即使在重症阶段，我们用中药配合一些西药，能够也让它能够改善了临床的症状。
Now, did you see improvements in the tongue? Did you feel improvements in the pulse as the medicine's working? Yeah. Dr. Shui Honghao told me that most of the patients admitted to Shanghai's Jinshan Public Health Center reported diarrhea, no matter the severity of their disease, for which TCM helped relieve the symptoms. Dr. Zhang Runhong, the head of Shanghai's COVID-19 treatment team, also talked about TCM based on the medical solutions at Jinshan.
所以这一次这个肠道的累积为什么特别重要？因为这个病毒的侵犯，它有 ACE2 的受体进来的，所以肠道里面有这个受体，所以肠道这次累积很多病人一进来，有些病人相当部分病人有腹泻，然后我们看比较重的病人，他都有肠胀气，大便一定要通。那大便怎么通？事实上我们西医有西医的做法。 但是在这个时候，我们至少在我们的专家组里面，我们这一次呢，我们都是依靠中医。我觉得请中医过来，而且他们都非常好的解决了这个问题。
先吃好饭啊，先把饭吃掉啊。
This corroborates with what Xu Zheng told me.
头几天呢，比如说头3天，我这个肚子就不舒服，就有点拉肚子，这块我也反映了。反映了以后呢，薛大夫说这块是排毒现象，这个呢是很正常的。
He even successfully persuaded one other patient in his ward at Jinshan to take TCM. This patient was not believing in TCM, but decided to give it a try after seeing Shu's recovery. In the US, traditional Chinese medicine does have fairly wide acceptance, with many clinics offering acupuncture and even cupping. With taking medicine, people are concerned about the possibility of side effects. What's been the experience with the side effects of the medicine to treat COVID-19?
可能是一个文化因素认为中医中药它这个制作的它的评价体系它的表达的语言不太容易接受。有一些个别的中药长期服用才会有它的临床副反应，包括一些消化道反应，包括肝功能、肾功能有一些影响。
More than 1,000 years ago, Zhang Zhongjing's treatise on febrile diseases was a good start to traditional Chinese medicine, with the concept of one patient, one treatment. But why did the scientific method not also inform traditional Chinese medicine? And why has the scientific community not accepted it?
曾经有人告诉我说，所有的中药的效果都必须要按西医的评价体系来做，对吧？但是我自己在觉得那个中医。 在我们整体的在我们中国的文明史上的存在，就是说从《黄帝内经》开始到现在，我觉得几千年了。难道就是说，在西医整个评价体系建立之前，我们是不是还是有一些中医自己独特的跨越目前的评价体系的一些额外的一些评价的方法？但中医里面有一个非常好的，我觉得他讲的有道理的，叫同病异治，异病同治了。 我觉得这个思维呢，我是觉得在我们对机制还不是非常清楚的时候，中医学科对我们有所帮助。事实上，我们都是乐于看到的。
Via conversations with doctors and cured patients, we learned some data, stories, and history, and the thoughts of professionals. The pandemic is an unprecedented worldwide crisis needing every available solution and resource to fight against it. The continued collaboration and exploration of the use of traditional Chinese medicine will be a very important addition.
这个就像武功一样的，有些武功可能会快一点，厉害一点，但有些武功就是慢一点，但是可以比较持久一点。现在看起来中医也不慢。